My name's Ruth Thomsen. I'm currently Scientific Director for London in the NHS England regional team. I sit under the Medical Director in there and have a really fabulous role. But I started my career at the age of 18 as a medical physics and physiological measurement technician, coming into the NHS with A-levels in science into audiology. So I've had over 34 years in and out of audiology in various leadership roles. Audiology is about really making a difference to patients' lives, or people with hearing impairments' lives. So we call them patients, but actually they're not ill. We really work with patients all their lives, and that's just been an absolute privilege. So in the 34 years that I've worked in the NHS, I still see some of the people I saw when I was 18, and we've grown together over those years, supporting them with hearing loss, supporting them with the developing technologies, supporting them with the thinking and the research that comes out. And it's just been an honour and a privilege to work in the profession. It really mixes science and the more holistic approach to being, so the rehabilitative models that we use, or from paediatrics, the habilitative models we use. And that, for me, as a communicator and an extrovert, works really well. So we get to do the science, but we get to do it in a way that encourages and grows the people that we're working with. So the training then was that you went to college and did medical physics and physiological measurement and specialised in a specific role. So it was called audiology technician, and there was a cardiology technical role, and all the clinical physiology positions. We did a generic training programme called medical physics and physiological measurement at college, and we took that up to HND level. And then we did our own professional body exams, and these were the only qualifications that were available to people working in our professional group at the time. We've watched that grow both through degree level, masters, and now with the modernising scientific careers, PTP, STP and HSST. So it's really a career that's developed with the technology and the science behind it. So this is a really wonderful, rewarding role. It often comes out as the top profession in the surveys they do in America to say what's one of the top professions you can ever work in. It's hugely rewarding because you're working with people's senses, and sensory health is really, and having good sensory health is the fuel for cognition. If you can imagine not being able to hear properly or not being able to see, how you wouldn't be able to engage with your families and your communities and with your health professionals. So if we can support people in improving their hearing, or improving their experience, or improving the surroundings that they're in to be able to have better communication, then we're really making a difference to people's lives, and we're really doing it for the long term. And that's the other difference. We don't just see people once. We see them generally for their lifetime if they have a hearing loss. And so you build a long relationship with those patients, and that's been really valuable, and it's really helped me understand the rehabilitative model, and that it can't just be a one-stop shop that fixes all, that actually we're in there with these people for the journey that they're on through their lives. So I'm going to move on from audiology and talk about the leadership role that I have at the moment in London. And it's a project that I've been working on for the last 2 or 3 years. And it was one of those things that came out of a conversation where we knew that scientists needed to be stepping up. There was a call to action for medical directors to appoint scientific leaders in their organisation. But actually, when I looked around in my role, there was development available for all the other professional groups, and scientists weren't really accessing clinical leadership. So with the help of HEE and their multi-professional learning department, we were able to pull together a programme called Practical Skills in Education, Training and Leadership. And we delivered that in London for 16 healthcare scientists who very timidly came in to a 4-day leadership development programme with statements like, "We don't do fluffy stuff." And these 16 scientists had never been in a room with scientists from other professional scientific groups. They'd only really stuck within their own professional group. And that's understandable because that's how they're employed, they're specialists in their field and they work in science in their organisation. But we know, and the evidence points to breaking down those boundaries and working across and delivering a system-wide approach. So it was the first baby steps into developing our emerging leaders, into giving them some tools and introducing them to other scientists in their patch and giving them some facilitation for action learning to really develop and grow as a different scientist who saw things in the system and could write and converse in a way that the system would understand a little better. I think that has grown now. It's been recognised by the Leadership Academy. It's a national programme. We've developed over 200 scientists through this programme now, and the feedback, the academic evaluation and the report currently to date show that it's been hugely effective in its aims and to achieve a growth in knowledge and leadership development. And we're watching a lot of the alumni grow professionally too and take up some really interesting leadership roles. So yeah, we've just been nominated and shortlisted for a CSO prize for that programme, and I'm so extremely proud of the faculty and all the scientists who took that great leap of faith to come into a room with a group of people they had never worked with and put some trust in something that was a bit soft and fluffy without a hard yes or no answer, and let go of that thinking and start to apply some of that to their scientific roles in hospitals. Someone once said to me, healthcare scientists, they don't really help themselves, which is a bit to hear as a healthcare scientist, but it's a call to action, I think. And I think that call to action is strong and clear from the senior leadership team. And it's strong and clear from certain scientific groups and professional bodies. But I think having that skill set and that courage to step out of the comfort zone, to do that versatilist model that Helen Bevan has shared with us, where yes, you are a scientific specialist, and yes, that specialism is true and important and you own that, but it's only going to work if you put it in the context of a health environment, and that actually something more general will have to come with that for it to flourish and grow. So the challenge is to try and enable people to see that bigger picture, get that strategy thinking and get that engagement. So yeah, I think that's the big challenge, is to really grow our leaders so they feel empowered to be able to do that. I think reflectively it would be to listen more, reflect more, understand your own power and use it wisely. Healthcare Science Week for me is to engage with all the scientific leads across the London trusts, which we're doing, to encourage their activities and share what's happening across London, make sure that they have contact their comms people and really are making a big noise about it. But then I'm working with Catherine Ross, the leadership lead in the CSO office, to deliver an event in our foyer in this building just downstairs here, to showcase science to the rest of the strategic thinkers in this building and the really important people in NHS England, so that they can really start to understand that scientists aren't just in the basement, but they're here and now and making innovation and technology work for our patients.